This is Jasmine Gel. This presentation is an overview of the chapter on principles of chemotherapy. Understanding the principles of chemotherapy is important in providing optimum care for patients with cancer. In this chapter, we discuss the basic concepts of cellular and tumor kinetics, principles of chemotherapy, modes of delivery to the central nervous system, and common chemotherapeutic agents utilized in neuro-oncology, including their most frequent adverse effects. One of the important basic concepts in understanding the cellular kinetics is the cell cycle. There are 4 phases of the cell cycle during which the cell prepares for mitosis. Cells that are committed to divide enter the G1 phase, where enzymes for DNA production and RNA are produced in preparation for DNA synthesis. In the S phase, DNA doubling takes place. Once the S phase is completed, cells enter the premitotic or G2 phase, where further protein and RNA synthesis occur in preparation for mitosis. During the final mitosis or M phase, cell division ensues, producing 2 daughter cells. These daughter cells consist of 3 cell subpopulations: cells that are non-dividing and terminally differentiated, cells that are continually proliferating, and cells that are resting but may be recruited into the cell cycle. In cancer, there is inappropriate cell proliferation, permitting the existence of an excess number of cells that contain all 3 subpopulations. Chemotherapeutic agents act on proliferating cells and are classified as either cell cycle nonspecific, such as the alkylating agents, or cell cycle specific agents, such as those listed in this figure. Adequate delivery of chemotherapeutic agents to the central nervous system remains a challenge due to the blood-brain barrier and the blood-tumor barrier. The blood-brain barrier is an anatomic and physiologic barrier that limits drug delivery in the central nervous system. Thus, strategies to circumvent the blood-brain barrier has been investigated to increase drug concentration in the tumor. There are several approaches to increase delivery of chemotherapeutic agents to the central nervous system, including intraarterial chemotherapy, which entails injecting a drug into an artery, disruption of the blood-brain barrier, such as utilization of MRI-guided focused ultrasound. Drugs can also be carried across the blood-brain barrier by a receptor-mediated transcytosis. There are also methods to circumvent the blood-brain barrier, including injecting the drugs into the subarachnoid space, local delivery by placement of chemotherapeutic agent impregnated wafer into the surgical cavity, and increasing chemotherapy dose. These methods are discussed in more detail in the chapter. The common chemotherapeutic agents and regimens utilized in the treatment of primary CNS tumors are shown in this table and are also further discussed in this chapter.